We had Dr. Mauldin, and she had identified Dr. Lampert as another person in the community who had actually a lot of experience working in primary care and working side by side with physicians. Together with Dr. Mauldin, they began to plan how their behavioral health team would look. As time passed, we thought, wow, we should bring some students on. It's a great opportunity for the students and it's great for us. So each of the psychologists, Dr. Lampert and Dr. Mauldin, supervised 2 students who provide a tremendous resource at the arm of the physicians on a shift-by-shift basis.
About 3 years ago, I was the only one here, and coming into a clinic of like 18 providers, the ideal is 1 behavioral health for 2,500 patients or 1 to 4 providers. So 1 out of 18, I felt like I was definitely outnumbered. And I quickly realized I came from a great school, George Fox, and I wanted to build a training site. We put them on care teams, and then when Joel came on the next year, we brought in another university, Pacific University. So we have 2 Fox students and 2 Pacific University students.
I was recommended to Chaos through our program director. This was a new site. No one had ever been here before, and she felt that I'd be a good fit here to kind of explore and experience and have a good time.
And I came to be at the clinic through just sort of knowledge of the exciting things that were happening here through our practicum process. I was really excited to come last year, and I've had a great year working here and training here and helping patients here.
They work the same shift as either Joel or myself for 6 months. They get to see us do interventions. We work with their charting. We read their notes. So before we launch them off to care teams, they have watched us do it for a month. I wanted to give them training opportunity, teaching opportunity, supervision. We do group and individual. We now have done peer.
If you are not prepared to be on your feet all the time, thinking quickly, it's going to be difficult. If you're not flexible and adaptable and a good communicator, it's going to be difficult. So I think the pace is absolutely something to be aware of and excited for. Coming here breaks down a barrier. I'm already in my doctor's office. I think we see a lot of people who would be otherwise fearful or worried about seeing any kind of a behavioral health situation, and often come back like, wow, that was so helpful, or wait, that didn't really work, I need some more ideas, and we can really start a great relationship with them.
The schools require evaluations, and we do that with the student.
We get an hour of individual supervision a week, and an hour of group supervision a week, and then an hour of peer supervision a month.
Joy and Joel have also modeled the type of work they want us to do. One, by doing that work, but also in their availability to us. Just like the providers could come get us at any time for help, we could come get the supervisors.
It's wonderful when we have them working with us because they follow us around throughout the day, and so we can be doing a well child and someone has a question about temper tantrums or sibling rivalry or whatnot, and the student can just stay with the family after we finish our part of the visit and talk with them for another half hour or so about whatever issues really they have questions about.
I saw patients that would have not otherwise been seen because I was on the elbow of the provider.
So I feel like I've built a capacity to understand behavioral health and the need for behavioral health, because even if the provider's primed, they still don't know how it's going to be for them in the moment. And now our providers get very uncomfortable when our students are about to leave, and they have about a 2-month gap of training before they get their next students. We've created a need. I think we've created an increase in service. We have been blessed with stellar students. I'm very grateful and honored to work with them.
When I looked at the numbers of how many patients I had seen, it's more patients than a lot of students see during their entire academic career. And it really inspired me to stay in this field and to stay in behavioral health. And it molded my academic experience that way. Like, that set my trajectory for what I want to do with the rest of my career.